Your healthcare needs are unique to you, so you'll want a health plan that will flex with you to provide care to help you enjoy your best health, and a company committed to you. Humana supports you beyond what you'd expect from a health plan, like helping you find the right doctor for you and looking for ways to save you money. It's all the large and small ways Humana works to help members feel their healthiest. We call it human care, and it lives in all of our plans.
We're here to help you get the Medicare coverage that fits your life.
We'll walk you through all the information you need and help you enroll in the right plan for you.
If you're new to Medicare, it's important to know when you're eligible to enroll in or change your Medicare plan. There's a pre-enrollment period beginning October 1st, when you can learn about and compare Medicare Advantage and prescription drug plans for the next plan year. Enrollment periods are the specific times a member may enroll in a new plan and/or disenroll in a plan or make changes to their plan. You can enroll in Medicare in the 3 months before and after you turn 65. That's your initial enrollment period. The initial enrollment period for Part D drug coverage is generally the same as for Part A and Part B. The annual enrollment period for Medicare Advantage and prescription drug plans is October 15th through December 7th. During that time, you'll learn about your options and can enroll in a plan or change to a new plan. However, it's important to know you should not submit your application before October 15th. During the rest of the year, if certain conditions apply, you may qualify for a special enrollment period, a time outside the usual initial enrollment period and annual election period when you may elect a plan or change your current election. Ask your licensed Humana sales agent if you may be eligible.
Let's think about your Medicare options. Option 1 is Original Medicare, Parts A and B, through the Centers for Medicare and Medicaid Services. Parts A and B help cover many hospital and doctor costs, but they don't cover prescription drugs. With Original Medicare, you may need a separate Medicare Part D prescription drug plan, or PDP. If you do not select a Part D plan when you're first eligible, but enroll in one later, you may have to pay premium penalties for as long as you have your prescription plan. Creditable prescription drug coverage is prescription drug coverage that is expected to pay at least as much as Medicare's standard prescription drug coverage. If you go 63 days or more past the end of your Part D prescription enrollment eligibility without Medicare drug coverage or other creditable prescription drug coverage, and then enroll in a prescription drug plan, you may have a late enrollment penalty. If you think you may need help covering your drugs, you may qualify for the Extra Help program through Social Security. After you've enrolled in Original Medicare Parts A and B, you may want to consider adding a standalone Part D prescription drug plan or a Medicare supplement insurance plan, or switching to a Medicare Advantage plan, often called Part C, from a private insurance company like Humana.
Now that we've discussed Option 1, Original Medicare, Parts A and B through the Centers for Medicare and Medicaid Services, let's talk about Options 2 and 3. Option 2 is Original Medicare plus a Medicare supplement insurance plan and/or a prescription drug plan if you need prescription drug coverage. A Medicare supplement insurance plan, also known as a Medigap policy, helps pay some of the costs Medicare Part A and Part B don't cover, such as deductibles and coinsurance. But Medicare supplement plans don't include prescription drug coverage. So if you take prescription drugs, you may need a separate prescription drug plan.
Option 3 is Part C. In order to enroll in a Medicare Advantage plan, you must have Medicare Part A and Part B and live in the plan service area. With or without prescription drug coverage, Medicare Advantage plans have all the benefits of Original Medicare. Plus, they may also have extra benefits, such as Go 365, Silver Sneakers fitness classes, and meals delivered after a hospital stay. Some Medicare Advantage plans may also include benefits like home health services in select areas. Plans with these benefits may offer the advantages of greater comfort and convenience, lower costs, and individualized care. Your licensed sales agent can tell you more.
One plan, one company. Simple. Keep in mind, you cannot enroll in a Medicare Advantage plan and standalone prescription drug plan too. If you want to enroll in a Medicare Advantage plan and have your prescriptions covered, you need to enroll in a Medicare Advantage plan with prescription drug coverage, or MAPD, which are offered through private companies like Humana.
Our members have access to Humana's Find a Doctor tool. It has a database of all the physicians in Humana's network. To make it easier to compare and choose, many doctors are also given a rating, which is based on quality of care and cost efficiency guidelines. That's called the Care Highlight Program. Clinical quality is indicated by the use of hearts. 4 hearts is the highest rating, 1 is the lowest. No rating means that there is not enough information to rate the doctor, or the doctor is in a specialty or geographic area where ratings are not available. Similarly, cost efficiency is indicated by the use of badges. 4 badges is the highest rating, 1 is the lowest. Together, 4 hearts and 4 badges means that doctor has the highest possible rating. Care Highlight ratings have helped Humana members across the country make more informed choices about their care. And Humana is proud to have earned NCQA accreditation for this useful program.
Along with your original Medicare Part B premium, you may have to pay an additional premium for your Medicare Advantage plan through Humana. Ask your licensed sales agent about $0 premium plans that may be available in your area.
Premium price is important, but there's more to consider when you're choosing a plan. A good place to start is by thinking about your current plan. Ask yourself a few questions. What type of plan do you have now? What do you like about it? What would you add to make it even better? Is someone helping you make healthcare decisions?
Medicare Advantage plans are available as Preferred Provider Organization, PPO, Health Maintenance Organization, HMO, and Private Fee-for-Service, PFFS plans. With a PPO plan, you have a network of doctors, specialists, hospitals, and other providers. You can also choose to see out-of-network providers without a referral. With our PPO national network, you get in-network coverage across the country for any doctor who accepts the plan terms, so you can travel easily or split your time between locations. With an HMO, you choose a primary care physician and have an established network of specialists, hospitals, and other healthcare providers. With a PFFS plan, you can see any doctor who agrees to Humana's terms and conditions. Because these physicians are not contracted, they can choose not to see you, except in cases of emergency. Always take your Humana member ID card with you and clarify coverage before services are provided. CMS prohibits combining a standalone prescription drug plan with a Medicare Advantage, HMO, or PPO, even if the plan doesn't include prescription drug coverage, but you can combine a standalone PDP with a PFFS plan.
All Humana Medicare Advantage plans cover virtual visits or telemedicine. This enables you to speak with an in-network medical doctor or behavioral health specialist from your computer, tablet, or telephone. You may use our Find a Doctor tool to select a doctor who's right for you, including telehealth providers.
Choosing an out-of-network provider or using an out-of-network emergency room or urgent care facility may cost you more. Staying within your network may help keep your out-of-pocket costs lower because the plan typically pays a larger share of the cost. Now that we've talked about when to sign up, your Medicare options, plan specifics, and prescription drug coverage, let's get you ready to enroll.
Your licensed sales agent will go over 2 important documents. One is the summary of benefits. The other is the plan's star rating, a 1 to 5 star quality measure of Medicare Advantage beneficiaries' experiences with their health plans. If you have an MAPD, your licensed sales agent will go over the drug list with you. It's important to note that even if your medicines are listed, Humana may require you to try certain drugs first to treat your health problem before we'll cover more expensive drugs. This is called step therapy. Some prescriptions require prior authorization from Humana. That means your doctor must get approval from the health plan before prescribing a particular medicine.
If you sign up for a Humana plan, we'll send your ID card in the mail. You can choose to receive other plan documents online. If you decide to go digital, we'll email you a link to activate your secure online account called My Humana. By providing your email address, you authorize Humana to send you health information at this address, so it's important to let us know if your email changes.
You'll complete a health risk assessment by phone or online if you've chosen our online option. This is to see if you qualify for any special health programs. And be sure to attend a member orientation.
We've covered a lot of information today, but if you have questions, contact your licensed Humana sales agent.
Another great resource is the Medicare and You handbook you should have received in the mail. You can also go to medicare.gov.
At Humana, if it matters to you, it matters to us. That's human care. Thank you for your time and interest today.